Good evening, everyone, and thank you for joining me again for what I think is going to be a really fantastic live for every woman and couple currently pregnant. And I think that the importance of talking about childbirth education and antenatal classes is so valid, more so now than ever before. And when I sort of look after any woman or couple during pregnancy, not only do I provide a lot of education about birth and delivery and the postnatal period, but I rely also on my midwives to provide that extra support to my patients. But I still recommend that all patients that I look after engage in additional antenatal education. And tonight I am absolutely thrilled to be joined by the wonderful Kath, who is a midwife who I've known for a long time now, who also is a childbirth educator and Calmbirth practitioner. And when my wife was pregnant, we did Kath's classes ourselves and we endorsed them wholeheartedly. We absolutely loved them. There were so many engaged couples there who were so interested to be learning and about what Kath had to say. And I just can't recommend them highly enough. A lot of my patients do Kath's classes and a lot of my patients who are midwives really love the classes themselves. So I think that speaks volumes about how wonderful I think Kath is. So I'm going to get Kath to join me now. It's her first Instagram live, so I'll just see if I can find her. I think she's not far away.
Are we connecting? Hi.
Hello!
Good evening. How are you, Scott?
I'm good, Kath. How are you?
I'm really well, thank you. Nice to
Excellent.
see you.
You too. It's been a while. How's your family? All well? Grandkids are
Everybody is
good?
great. Yes, the two babies are 6 months old next week and the week
I
after.
can't believe it. Gone
I
so quickly.
know. I know. They're just delicious. They're really beautiful
Excellent.
boys. In fact, I
Brilliant.
think they're gifted.
Really?
Isn't that what old grannies are meant to
Oh,
say?
Kath, my parents tell me the same thing about our little one all the time. I'm
Yeah.
not quite
Yeah.
ready to believe it, but they're
Yeah.
convinced.
That's so
Excellent, Kath.
good.
Fantastic. Well, thank you so
Yeah.
much for joining me tonight. I'm absolutely thrilled. I think that the importance of childbirth education is always so important, but at the moment, with sort of the restrictions imposed secondary to COVID-19, meaning that it's very hard to access in-person childbirth education, I think has meant that our talk tonight is particularly important for a lot of couples who are feeling very anxious about pregnancy and childbirth and new parenthood. And I'm hoping that you'll be able to impart some of your wisdom and your wonderful techniques as a midwife and Calmbirth practitioner that will help people through, what is a challenging journey for a lot of people at the moment. So I've got quite a few questions for you tonight, and hopefully we'll have
Absolutely.
time to go through all of them. But
Yeah.
I want to start just by asking a little bit about what it was that interested you in becoming a midwife and a childbirth educator to start with.
Yep. So when I became a midwife, I wanted to look after women in a holistic way. And
Yeah,
so rather than just getting to care for the women in a labour setting,
yeah,
I wanted to make sure that I understood how I could help them through their birthing, but prior to that, really educate women in the clinical setting in the antenatal clinics. So I wanted to go off and do some training around that. So I started off with joining the Childbirth Educators Association and really delving into how to teach it correctly. Never had a teaching background myself, had no idea how to run a workshop. So
yeah,
I really needed to do that well. So I started off in the community
yeah.
and I was teaching through some of the councils. And then it just sort of evolved into wanting to extend my practice as a midwife, but more importantly, as a childbirth educator, to give not only just the women the care, but also the partners.
Yeah.
So that's how I sort of headed towards Calmbirth.
Excellent. It's quite interesting you say all of that because I think that obviously my practice sort of incorporates both private and public obstetrics, but that's what I really love about having my own private practice. It's that I get to look after women and couples right through the pregnancy, through the birth and the postpartum period, and you establish really great connections, and you can, realise that what you're going through with them early in the pregnancy has such an impact upon them later in the pregnancy as well. And that's really what I love about having my own patients and a private practice. And I can sort of understand exactly where you're coming from. So I sort of understand completely why you chose to go down that path. What was it specifically about Calmbirth, though, that interested you, and how did you become involved in Calmbirth?
So when I was in my very early days as a midwife, I went into a room with this couple that were completely different to any other couple that I'd ever seen. And I had been in many births, many with you actually, and we'd seen lots of ways of babies being born and lots of couples going into labour. And this particular couple were different. They had a different environment in the room. They looked prepared. They looked empowered. It just felt so different. So I went and investigated what Calmbirth was all about, and I really liked their philosophy because I believed that it was a holistic look at the team giving birth, involving the midwife, involving the woman in labour, involving the partner, absolutely involving the partner, and really having an understanding of how that baby was being born and how that baby was travelling through the birth canal, what that looked like as a family when they were born, and then looking at it as the holistic approach with getting them home and helping them and supporting them with breastfeeding. And it wasn't just about the day. And that's what I loved about Calmbirth. And when I investigated it, why this was just not all about labour, and it's not necessarily even about having a normal vaginal birth. It's about everything about having that big day arrive, and then more importantly, what happens in the next couple of weeks afterwards.
Brilliant, excellent. I'm going to come to a lot of those points that you've made sort of over the next half an hour or so. And you've alluded to sort of what it is about Calmbirth that really grabbed you. But for people who've never heard of Calmbirth before, what is it? How would you describe the key principles of Calmbirth?
Calmbirth is a philosophy of childbirth ed, and it's using different techniques to get the woman through that big day. And it's using relaxation and meditation, and a very basic form of meditation, but relaxation is a really big part of it. Breathing techniques. Now you think, why do I need to learn how to breathe? But there's loads of times when things get very overwhelming in a birth, and there might be a few crisis points where the breathing can become everything. The breathing is a big component, and more importantly, there's visualisation. But the number one thing that I love about Calmbirth is that it helps teach the partner strategies to get through this big day with their partner. So they're not that person just being a little bit nervous in the corner or not knowing where to put themselves in the room. They are empowered as well, and they've got a huge job to do. So Calmbirth is a philosophy about all of this and how to prepare. It's not just turning up and rolling on one of the fitness balls, or it's not about, talking about what the baby is going to be dressed in when the baby comes home. It delves deep into how the techniques are going to help you get through that labour.
Absolutely. And you talk a lot about meditations and visualizations. Is that hard to teach? How do you sort of impart those sorts of things to the women and couples that you're seeing in your classes?
During the period that we've been living in, the environment we've been living in recently with COVID, I have really had to modify the way I teach this Calmbirth and relaxation. I've been teaching Calmbirth via Zoom since March, and let me tell you, every person that's been through the course since March has still said how empowering it was that they actually had these techniques, including the relaxation. So the relaxation normally in a day-to-day face-to-face workshop would be done in a beautiful dark room with great music on and on
Done it
great
myself.
cushions, on the beautiful cushions, and then you take those relaxations home and you practice that, because the relaxation is all about that relaxation response once the contraction finishes. If that uterus, that really big muscle in the body, is completely relaxed in between the contractions, it's going to have better resting tone, and it's actually going to work really more effectively with the next contraction. And therefore, every contraction that comes along is working really efficiently to get that baby down onto that cervix and through into that birth canal. So the relaxation, say for instance, if I have never met anybody before, and if I walk into a labour room, I will teach them how to do the relaxations. Very basic stuff. And Excellent. I will also teach them the breathing techniques, because that becomes a very big focal point all the way through as well.
Excellent. And Kath, what about the environment that you help people create to make it relaxing? It's obviously not, simply about the breathing, but it's about an environment that is conducive to allowing that to happen. What sort of tips do you give women and couples to help them to create that environment that allows them to relax and engage in all of these techniques as best as possible?
So it all begins right from the time that first contraction happens at home. I get everybody to start to visualize how they're going to prepare that beautiful room at home, because a huge percentage of your labour will be at home. So people don't realise that labour can be anything from 24 to 36 hours long with the build-up, and really getting that baby right into the birth canal can take quite a period of time. So a huge majority of that time of that labour can be spent at home. And if you create a safe environment for your girl where she feels really empowered, but more importantly, she feels undisturbed. She needs to feel safe, and she needs to feel really understood. You're creating that environment by keeping the room really dark, the music on to a great, a great sound, keeping really good fluids up to her, and keeping your girl in her home environment. She's going to progress a lot quicker.
Great.
People make the mistake of actually going into the hospitals a little bit too soon sometimes, and you've always got to be guided by your care provider, clearly.
Definitely.
But the place at home you prepare as like you would be preparing almost like a spa day. I know that sounds a bit cliche, but dark room, beautiful candles, great music,
Perfect.
all your favourite drinks and all your favourite foods.
Brilliant. And do you still recommend that when, women and couples are told by their hospital or their care provider that it's time to come to hospital, should they bring these sorts of things with them so that they can create a similar environment in the hospital?
Yeah, absolutely. And one of the great jobs that the partners do as support people is when they get into that room, they create this incredible room in the hospital. And everybody always knows that the couples that have done Kath's Calmbirth, because there's like little tinkly fairy lights everywhere, and little tiny flameless candles. But women will labour better with low lights. And if you create that same environment in the hospital, it really creates almost like a vibe before people come, when they come into the room. They know that you've got this. They know that you're prepared. And I'm a true believer in creating that room to feel really safe for the woman.
Wonderful. Excellent, Kath. And you've sort of spoken about it already, but what are the benefits of Calmbirth in terms of, a better labour, better contractions? You've sort of touched on a few of them, but what are the proven benefits of Calmbirth? Why, apart from feeling relaxed and comfortable, in terms of actually, progressing well in labour, what do we know to be the benefits?
It's not my job to tell you what I should think you should do in labour. My job as a Calmbirth practitioner is to give you lots of options, and then for you to go away with your care provider and work out whether that's suitable for you. But it's most importantly giving you choices.
Great.
So Calmbirth is about giving you choices about lots of various things that can happen during the day. If you have an understanding of the phases and stages of labour, and also some of the things that run behind labour, then you have an opportunity to make informed consent, give an informed consent with your care provider. And I truly believe that informed consent is a massive part of maternity care, because we want women to have a great outcome. You know, we go to work every day to give a person a very beautiful outcome, a great outcome. We don't go to work thinking, I'm going to really upset somebody's day today.
Absolutely.
We go there wanting to give them the best opportunity. And that informed consent is a massive part of the course, where we talk about what your options are. Not up to me to tell you what my opinion is. It's about you guys working it out with your care provider.
Absolutely. And I say exactly what you're saying to all of the patients that I look after. I say that there is no one way for pregnancy, labour, birth that will be right for every couple. And it's my job as well to make sure that they're equipped with all the tools to decide what is right for them, so that they can have the best experience possible in their eyes. And that is going to be different for everybody. So it's about giving those sort of different broad approaches that each woman and couple can look at individually and say, this is what I want. And I think that, you know, setting your own expectations for the day is really important. That leads me sort of into the next thing I want to ask you about. And I remember a sort of part of your course talking about this. Now, a lot of women say to me, Scott, should I write a birth plan? And if I write a birth plan, how detailed should it be? What is your take on the birth plan? Is it a useful thing to do? And, you know, what do you tell the couples that you're educating about writing a birth plan for the big day?
So I think birth plans have got a really bad rap over the years. I've seen some fantastic birth plans, and I'm sure you're the same. You've seen ones that are just so protracted and so long-winded, it's almost like there's a battle being set up early. That's not a birth plan. That is so not a birth plan. And I truly believe that when you actually have an understanding of what labour and birth is, then you start jotting down some things that are important to you. It's about communicating to your care provider exactly what's important to you. So it's not important to what we call it. Is it a birth wish list? Is it a birth preference? Is it a birth plan? It's all about communicating what's good for you guys. And I'm a true believer that care providers should be involved in this, because you can set up an unrealistic expectation by having a plan that can be thrown out the window within an hour of labour. And if you're too rigid with your birth plan, you're just going to be so disappointed when things go off the path somewhat. So the birth plan is to communicate things that are really important to you and your partner. Not to dictate on how the birth you want it to be, or of criticism of the care providers that you're working with. You should be working as a team, and this can be written in a really good way. And I help write a birth plan with couples within a minute, because we talk about good language and we talk about good options.
Excellent, Kath. And obviously, not all birth plans go to plan. You know, as you say, if they're too rigid, then often it sets women and couples up for disappointment when they don't go, you know, exactly as they'd hoped for. But is there any advice you can give to couples that they can employ when things aren't going exactly to plan? You know, the woman who's had her heart set on a vaginal birth, who gets really bad fetal distress in labour and is told by her care provider that she may need a caesarean section. What sort of advice would you offer to people to help deal with those situations?
And everybody wants the best outcome for their baby. Everyone wants the
Definitely.
best outcome. Every partner wants their partner to be safe, and
Absolutely.
and wants their partner to go through a great labour. But
Yep.
unfortunately, we live in a world where sometimes babies can be tricky.
Yep.
Sometimes the position of the baby can be tricky.
Yep.
Sometimes inductions don't go to plan. Sometimes, babies just remain breech no matter how many, attempts of turning we do with external cephalic versions. With all of
Absolutely.
these things that can go on, I think that if you go into a birth with a pretty realistic expectation of what could happen, that
Yeah.
when it does happen, that you're not so overwhelmed. And I know that with Calmbirth, the head office, a few years back, they actually did a survey with lots of Calmbirth couples, and what they spoke about was when the women and the partners had along the way that they had assisting within the decision making that was made along the way, they were happy with the outcome regardless. And I think that with around a little bit of the world of birth trauma and birth dissatisfaction, so to speak, it's about setting up realistic expectations that, there are still going to be a percentage of women that have Caesars, and there's still going to be a percentage of girls that have instrumental births. And we can't predict that. But what we can do is we can give you, knowing that you've got great care around you, knowing that there is still great options, even if you do go on to have a cesarean section, that Calmbirth is a fantastic holistic approach about thinking about still doing delayed cord clamping, still doing skin to skin in theatre, still having a fantastic approach to a women-centred birth. And I've been in quite a few Caesars with you where it's very women-centred, and I think that that's the new frontier with Caesars, that cesarean sections. And I truly believe that women still should not feel like it's a failure that that path has gone off, their birth has gone off the path. That birth is not failure. Birth is a day. It's a day that we're going to have this baby, and you're going to care for that baby well past that birth. But along the way, as long as you constantly understand and your care provider is explaining and giving you lots and lots of discussions around what's happening, if there's time, obviously, then, you're able to make that informed consent and give informed consent along the way. And that means everything with an outcome. And Calmbirth is not about having, a normal vaginal birth necessarily. It's about, getting that baby out with good APGAR scores, good everything about the environment afterwards. All the Calmbirth things you can still do back in your room, creating a beautiful room with great lights and creating that great environment for that little person to transition well.
Brilliant, Kath. I could not have said all of that any better myself. Just to sort of give a slight anecdote, which I think echoes what you're saying, I had a patient who I looked after probably about 12, 18 months ago now in my private practice, and she had actually been planning on a home birth and unfortunately had a placenta previa. So, as you know, a low placenta in the uterus, which unfortunately necessitated a caesarean section. And we had extensive discussions prior to the Caesar about how we could still make it an incredibly positive experience for her and her partner. And she sent me a really lovely letter afterwards, essentially saying that it was the best possible birth experience that she could ever have had. And I'm not sort of saying that to, blow my own horn in any way whatsoever, but rather that it is about creating an experience that you want it to be, and knowing that those positive things that you'd spoken about, like delayed cord clamping and skin to skin, can still happen. And it's about putting the woman and her partner at the centre of the birth experience. So beautifully said. I couldn't agree with that anymore. Now, moving on to our next sort of topic, because we've got quite a bit to get through and I'm enjoying this discussion so much. Partners, you've spoken tonight already about the importance of the partner in creating a really positive experience. what is the overall role of the partner here? So you've spoken about creating a nice room, an environment, and doing all of that. But how should the partner envisage their role on the day of the birth? Not always a partner, I suppose. It might be a different support person. There are lots of women who choose to have kids on their own nowadays, and they either bring a friend or a relative. For anyone, what is the role of the support person essentially coming into labour?
So 60% of the role, or Calmbirth 60% about the partner, I believe.
Yeah.
Because, like I said, I've seen so many nervous dads, in that room with that babe or that partner as their partner's giving birth.
Nervous and fainting.
I've got a theory that we used to lock them out, and now we lock them in the room.
Yeah.
And they're scared. I don't blame them, And one of my jobs as a Calmbirth practitioner is to get them really ready. And I do that by getting them to little things, like little tiny things that can contribute to the day, like they need to pack the labour bag. They need to have ownership over that bag. And the reason why they do that is I've been in labour and I know what it's like to need something out of that bag.
Yeah.
And if my partner knew exactly where those things were in that bag, it makes all the difference.
Definitely.
So you get to be uninterrupted, labouring. You also need a person to be your advocate. And I'm a true believer in setting up this environment where it's a team. The three of you are giving birth, the baby, your partner, and the woman. And you're also got a job to do to be her advocate. Be the advocate between, the family at home and the family on the phone, and, some of the staffing. If you're not sure about something, you need to almost be the protector around her. And women are very vulnerable on that day, and they're very vulnerable for the couple of days afterwards. And I truly believe that the guy's role is to protect her and to make sure that she is uninterrupted in birth and has a environment where she doesn't need to be thinking about something. The drink is already there, something to eat is already there. She hasn't been to the loo for a couple of hours. I need to get her to the loo, little things like that. And I truly believe that there is a role that is so underrated. These guys or partners have a huge job to play of getting this little person out. And, their role is, I can't underestimate how nervous they must feel, but I also know that the guys, when they leave Calmbirth, are high-fiving because they always want the baby to come that night because they're so pumped and ready for it to happen.
Absolutely.
So,
Great. And I remember when we did your classes, an important part of what you included in the role of the partner was pressure points. Is that something you still teach?
Yeah. So I was really lucky enough. The good thing about Calmbirth is that they're always upgrading and updating our skills. And as practitioners, we need to keep learning about how where things are going and where things are heading. Pressure points, I believe, are a default button, like the breathing techniques. And the breathing techniques become everything, but the pressure points are extraordinarily important because the guys they don't always know what their role is. And if they're given even something as small as a physical role, as massaging or pressure points, and they know that they work, I have every faith that they will do them throughout the labour. And I give them a resource folder, and in there is lots of examples of that. In my particular workshop, all the guys get to be pregnant first, which is hilarious. So they get the massage first, as you remember, Scott. And
I do.
They and they get to crack all the pregnant jokes. So they have the shortest gestation in history. They're pregnant for about 20 minutes.
It's long enough.
And then they get to switch over with their partners, and then the partners also get to to experience where those pressure points work. But they need to practice those along the way, because the pressure points, it doesn't come easy for everybody to know where they're meant to be. And I can tell you that when they work, it really works. And I love teaching that particular part of the course, because it gets everybody up and moving, and they feel like they've got something, you know, physical to almost to do throughout the birth as well. Yeah,
definitely. Excellent, Kath. Now, I think when you mention the word calm birth, I think there are a lot of people who just presume calm birth means no pain relief at all. Now, I know that that's not true, and as you said, it's about informed choices. When you do your calm birth classes, do you talk about different pain relief? I mean, I know the answer, I've done them, but for everyone else watching tonight, do you talk about pain relief options in labour?
Yes. So calm birth is not some kind of silent birth where women have to be quiet, and you'll hear lots of comments when people say you're going to a calm birth course that, you know, they think, oh my God, how can birth be calm? But what we're teaching you is that we're going to get you through this with all the choices you have. And if that means that you walk into a room and you need an epidural early, well, then that's what you're gonna have. But my role as a practitioner is to teach you what will interfere and what will change the path. And every bit of pain management, whether it be non-pharmaceutical or pharmaceutical, is workshopped and spoken about in depth. And by the time you leave, I hope that you're able to make some really good choices, and why we wouldn't give morphine too close to the birth, or why you would only use the sterile water injections, for instance, if your baby was posterior. So there's a bit of theory and a bit of work behind what we talk about.
Great.
And more importantly, it's about you guys knowing that you're not just going to walk in, because there's lots of TV shows and movies that have made all these things pretty benign, and they're not. They're procedures, and they're serious things sometimes. And you have to absolutely understand that some of them, and nearly all of them, change or alter the way your birth will be. And it doesn't mean that we want you to have no pain management, but one big concept of calm birth is we also talk about the perception of pain and what that pain is. So if you walk in really tense and really nervous about having a contraction, your body is never going to relax enough to let that baby go onto that cervix and open that cervix enough. So absolutely, the non-pharmaceutical forms of pain management are incredibly important. Things like water, things like keeping active, getting upright, staying upright is just so important. And I talk extensively in the class about positioning of pushing and positioning of birthing, because if you're in the bed, you potentially aren't going to be able to get that baby on the cervix. We need gravity on your side. We need, once your girl is in that active phase of labour, we need her upright and out of that bed. So my job is to teach you how to get through those early phases and active phases, and leaving all of the big guns to the very end if they're there. They're always there if you need them. No one's ever going to deny you an epidural, because we're not into that.
Correct.
Nobody's into denying anything to anyone.
Agreed.
But we're going to teach you your options about when and how your the best approach is to when to have the gas and when to have the epidural, or when not to have any of those things as well.
Absolutely. Excellent. And what I've sort of gathered from this is that, calm birth is not about one way of birth or one way of labour. So for couples who, they are at the time of booking antenatal classes and they've been told, look, your placenta's low, there's a high chance you're going to need a caesarean section anyway. Is it still useful for them to do calm birth, would you say?
Sure,
is it still a good option?
absolutely.
I completely think it is, but I just wanted to see what your take on it is.
There is there is lots of work being done around, you know, what that approach up leading up to that day and getting really good, you know, hormones to that baby, you know, keeping cortisol levels down, going into that labour with a really good attitude, with a great body and mind connection, so that your body and your mind is birthing that baby. Making sure that, you know, your oxygen levels are great, you're doing some great breathing, that baby is completely getting everything it needs before it enters this world. And more importantly, calm birth is, as I said, is also about everything else that happens after that very moment. So the breast crawl straight afterwards, you know, finding that nipple for the first feed. It's also, you know, going home with that baby. It's about transitioning as parents. And it's also about working out what your role is as a parent, what kind of a role, what kind of a parent you're going to be. And that is why it's not just about a drug-free normal vaginal birth. It's about lots of other things as well.
Excellent, Kath. Now, I know a question I get a lot as an obstetrician from women in the lead up to a planned vaginal birth is about how we can reduce the risk of perineal trauma and perineal tearing. And I think it's actually one of the greatest anxieties and fears of women leading up to a planned vaginal birth. And I know that certainly in your classes you talk about this. So what is your advice about perineal care to the couples that you look after?
How you push, where you push, how that's happening, what position you're in. There's lots of great work being done behind this in some great tertiary hospitals in Melbourne. And it's about protecting that perineum, not just in the birth, but prior to the birth. So having good nutrition, you know, doing some really good pelvic floor exercises every day, and using even some bio oil, massaging that perineal area from 36 weeks for 10 minutes a day. That's all it's got to be. And then when you're in that birth and, you know, getting on your hands and knees, getting on your side, birthing with that pressure off your perineum, but listening to your care provider, whoever is birthing that baby, so that as that little baby's head is crowning, you're not going to do an enormous push that baby's head is going to be popping out and doing some, you know, any tearing that's not necessary. So I really believe that if you're listening to your care provider and listening to them as they're saying little pushes, you're going to breathe that baby out. Having said that, we're also doing some great work around compresses. So hot compresses to the perineum in the last hour of pushing. And that is just getting a really good blood supply to that area. And, you know, just making sure that if listening to your care provider, listening to your obstetrician, listening to your midwife, that when they say to stop pushing, as hard as it can be, you stop pushing.
Absolutely. And I think at that point, you know, as a care provider, it's, you know, my responsibility to make sure that I'm in control of the situation as well. And that, you know, I'm doing what I know will reduce the risk of perineal trauma as best as possible, but communicating really effectively with a woman and her support person. And that's where, you know, having a woman who is relaxed and, you know, calm is very, very helpful, because there is this instinctive urge, obviously, to push. You know, there's that incredible burning and stretching that's going on, but it's our job as midwife and obstetrician to, you know, make sure that that's controlled, and to make sure that when the head is sort of crowning, that everything is done with complete slowness and control to reduce the risk of trauma. But working together as a team there is so important. And you know, I think if couples are prepared and have been taught about, you know, what's going to happen at the end as the head and body are coming out, then they're really well prepared, and that they can, you know, do whatever they can to help reduce the risk of trauma. Couldn't agree more.
Yeah, and trusting in your obstetrician and trusting in your midwife.
Definitely.
That, you know, that they've done this before, so they want to protect your perineum as much as they possibly can. They don't want you having birth trauma later, and they want you to have a really, you know, a good outcome afterwards as well. But You know, we tend to sort of feel that women think that they've had a normal vaginal birth and, you know, oh, that's really good. But, you know, if there's a very bad tear, that can be as traumatic as a really rushed or emergency cesarean section. And
Absolutely.
yeah, so
Absolutely. And I think as an obstetrician, I was going to say, I think as an obstetrician, a lot of people have real fear if I, you know, suggest that they may need an instrumental birth with a vacuum or forceps, that it's going to significantly increase the risk of trauma. And as I say to them, you know, I've done this a lot of times before, and that's why the training is so extensive and so long, because it's about making sure that that is something that is given absolute respect from the perspective of the obstetrician, and that, you know, we work together to make sure that the woman gets the best outcome. But you're right, you know, a natural birth with a significant perineal tear may not be what the woman wanted or was aiming for, and the long-term implications of that can be so significant that I think preparing for reducing the risk of perineal trauma is critical.
Absolutely, yeah.
Excellent, Kath. So we've now had our baby. It's all gone beautifully, and I know that something that you've already sort of alluded to tonight is skin to skin, and regardless of the mode of birth, I think that's a really important thing. Why is it so important?
Skin to skin is the basis from the moment that little person is put up onto your chest. You know, it's where all the magic happens, and that incredible first 10 minutes of them being born, where they're splattering, you know, they're coughing and they're bringing up all the lots of fluid. The safest place for them to be is on their mum's chest, and it will help the baby transition better onto Earth's side, as we like to say it, and it will help the girls with their blood loss, hopefully, because they're going to produce lots of oxytocin when they're looking at their baby. And that's going to help reduce, it's going to help reduce all of those aspects of, you know, the bleeding, but more importantly, it's going to help the placenta to be born. On the baby side of things, the baby's getting all these fantastic bacterias and things that are meant to be happening. They're going to regulate their temperature to their mum, and that's why I mentioned before about having skin to skin in theatre, how those things can start straight away. You know, there used to be a thought that the theatres were too cold and that the babies, you know, would be cold on their mum's chest. It's actually the opposite. That babies need to be kept warm. You know, they're not great temperature regulators, little people, and they're going to look for that breast, and they're going to do that breast crawl. And I empower everyone to find on YouTube or anywhere they can the breast crawl, because I wasn't a believer until I started my midwifery training, and then I started to see it, and it is truly extraordinary how those little people, their job is to find that breast, and they do.
Absolutely.
And it's something that I believe that can go on and on and on, skin to skin. You know, skin to skin is not just about having, you know, in that first hour. Skin to skin is so important if the mum has to go off to theatre, if the woman has to go to theatre for a repair, or there's bleeding, or the placenta hasn't come away. I get the partners to do skin to skin straight away, because that whole transitioning to life on the outside world has to continue with the bonding and everything. And it's so vital for the dad to continue that as well, the partner to continue that.
Absolutely.
And when in doubt, if your baby's not settling at home, skin to skin.
Excellent, Kath. Absolutely. Now, it's not just a transition for the baby, but it's a transition for new parents a lot of the time. And I know that Calmbirth also aims to prepare parents for leaving the hospital with their new baby. What aspects does it cover, and how do you best prepare them for that side of things?
So how do we all remember that drive home, huh? So that first drive home with that first baby, where you're driving just like, oh my God, I thought my partner was driving at like 150 kilometres an hour, you know.
Actually doing 10 kilometres per hour.
So I think with our daughter, I was in the back seat and
Yeah.
I was like, terrified that the world was going to destroy this little person's life.
Yeah.
And then with our second child, I think I even went to the country road sale on the way home. So I think you do get a little bit more relaxed along the way.
Definitely.
Going home with a newborn baby, I have to tell you that everybody feels the same nervousness and everybody feels that same feeling of, what am I doing now? What am I doing with this little person?
Yeah.
And I love the whole 40 days and 40 nights thing that lots of cultures do, where the women do nothing. Your baby needs love and food. That's all they need. And if everybody around you can look after the woman who's breastfeeding, the woman who's recovering, and help the family to transition as a family, including the partner, then I believe that they have a really good head start in life, that little person's been given every opportunity, breastfeeding gets established. And I always tell girls that when you think you're breastfeeding in the middle of the night and you think you're on your own, you're not. There's millions of people doing exactly the same thing around the world.
Yeah.
And I really believe that if you think about that, and if you believe that, and think about all the community resources that are available, you don't have to rely on old-fashioned books. There's so much information now on the internet and through the community that women are set up really well. But there's also a lot of isolation, and and women find it a bit hard, particularly in this COVID world.
Yeah, I was just going to say that.
Not being connected to their families, and you've just got to keep Zooming, and you've just got to keep accepting that beautiful food that's on the front doorstep. And
Definitely. Absolutely. I say to so many people, gifts are so generous and kind, but if, anyone asks you what they can do for you, ask for things that are going to save you time and help you. Like cooking is the most important one, in my opinion. But I remember we used to just say to family and friends, if you want to help us, just make us something to eat, because when you are exhausted, and I remember that sort of witching hour in the evening, pushing the bassinet back and forth, just desperately hungry for dinner. If you can just pop something that someone else has made you in the microwave, it really, really helps. But, get the community and your loved ones to rally around you. But it is, I do acknowledge it's very difficult at the moment with the world that we're living in. But, the help that you can get, just accept whatever people offer, I think.
Yeah. And nothing stays the same. All this will pass. And
it will.
I think that everybody's got this extraordinary gift that we get to be with our families so much more at the moment. And we're going to look back on this.
Yeah.
We're going to, those little babies born in this world at the moment will be COVID babies. And I'm sure that life will go on for them, and they'll have their own ups and downs throughout life. And, I think we'll get through this.
Absolutely, Kath. I completely agree. Well, I think that has been incredibly useful. I just want to ask you sort of something on a more personal note. What is it that you love the most about what you do? You're clearly so passionate about what you do. And in every role that I've ever seen you, whether it's, as a midwife or as a childbirth educator / Calmbirth practitioner, you're so passionate and you invest so much in the couples that you look after. What drives you? What do you love the most about what you do?
The thing that I think I went into this whole Calmbirth thing for was to assist people to empower themselves and to make sure that they had every bit of knowledge that they possibly could have. And I love seeing that family born. I love seeing the dad's reactions. I have cried. I don't cry at births very often, but I quite often cry when the dads start crying, because I'm a big softie when it comes to the guys. And I truly just love my job, and I've got a bit of a different role at the moment, but, everything's exactly the same. It's about getting that baby born in the safest environment, in the most happiest times. This is an amazing time for couples when they're having a baby, and it should be the happiest days of their lives. It's not going to be easy necessarily, but, I just love seeing how they transform into this family, and they walk out with the capsule, and and the other thing I love is getting emails from families that have done Calmbirth and telling me their stories. Now, I don't care whether they've had a vaginal birth or a cesarean section or an instrumental birth. I just love hearing their stories, and I love seeing the photos of the babies because I feel like I've invested in them and invested in that little person being born, and I just love my job. I really do.
Absolutely, I can see that, and you have invested so much in these couples that you look after, and we're all very grateful for it. Can I? There's a question that's come up on the screen here, and I think I know the answer already, but it just says, "Are you same-sex couple friendly in your classes?" Absolutely, you are.
Oh my goodness. Yes, I talk about how important it is that every person should be supported. You know, we've got lots of material that we have changed throughout the years, that we're not, you know, necessarily just dealing with, you know, like talking in language with, you know, about men and women. We're talking about same-sex couples, and I've had loads of babies and same-sex couples coming through. I'm very, very excited about the surrogacy laws that have come through in the last few years. And that is just so empowering for same-sex couples on both sides. And I'm looking forward to having my first, you know, guys. I think that'll be great.
Absolutely.
Really
excellent, Kath. So finally, you know, your classes are just brilliant. We love them. We tell so many people to do them. We've sent so many of our friends. I sent so many of my patients your way. How can people register for your classes, and when should they enroll? I know they fill up very, very quickly. And there are lots of couples who register a little bit too late, but they do fill up really, really quickly. And I like that you keep them, you know, small and intimate, which is great. But how can patients register for your classes?
So I used to say people should contact me after their morphology scan, but I'm finding that people, they can contact me the minute they're pregnant if they want to. You know, I'm happy to have a conversation with them. I'm happy to discuss what Calmbirth's all about. Probably the best time to attend Calmbirth is anywhere from 28 weeks to 36 weeks. Having said that, I've had a couple that were induced that night of the second workshop. So, you know, if you get the chance to do a Calmbirth course at any time, it's fantastic as well. But basically after the 12-week scan, or the first trimester screening, is probably the best time. I'm so thankful and so in awe of everybody's support, because I am booked out till December. I could do Calmbirth every weekend, but I don't think my family would like that. So
no,
I try
completely
to do
understand.
I try to keep it to a small group. And I try to do it once a month. And
perfect. And it is 2 classes, is that correct, for each couple that comes? Perfect. And how can they enroll? Where can they go? Do they come to your Instagram page, to your website? What's the right way?
Probably to my website is Kath Calmbirth, and it's really easy. Really easy. That's just like shopping online. You just book in, and I send you lots of lots of information along the way. And I'm certainly, I'm not sure when we'll go face to face, but I just know that Zoom is working just as well. And I'm very fortunate enough to do it.
Brilliant, Kath. And for anyone who's watched tonight who has questions for you about your classes, can they just send you a message via Instagram?
Email me,
Brilliant.
at kathcalmbirth@gmail.com.
Beautiful. Excellent, Kath. Well, thank you for everything tonight.
Thank you, Scott.
I'm so grateful, and I will certainly continue to support your classes by sending as many patients as I can your way.
Thank you.
Excellent. Thanks, Kath.
Hey, see you later.
Have a good night. Take care. Bye.
Thanks.
Bye.
Bye.
Bye.